You know that you can actually tell if your patient needs fluids just by using end-tidal CO2? Let me show you. Okay, so let's talk about the physiology of why this may be a benefit in order to identify fluid responsiveness. So basically the idea with this passive leg raise, we raise the legs and basically are going to increase blood return back to the great vessels, particularly the superior and inferior vena cavas, and they are going to pull their blood back to this right ventricle. So this is essentially all about preload. In a patient that has fluid responsiveness, or they have a lack of fluid, they're going to have a smaller amount of preload. They're going to have less fluid that's returning back to that ventricle in order to be compressed and move through the lungs in order to be oxygenated. So if we do a passive leg raise and we increase the amount of blood return coming back to this right ventricle and essentially increase preload, that's going to be actually more blood increasing inside the pulmonary veins. And what we're going to see there is an increase in end-tidal CO2 because we've improved perfusion, ultimately improving the preload by returning more blood back to the heart, thus in turn improving the end-tidal CO2 and the increase. So if we see an increase in 2 points, that's a positive indication of an improved perfusion, suggesting that this patient could benefit from a fluid challenge. Okay, so now that we know the physiology, basically how we do this test to determine it is that first off, we're going to get our patient in a Trendelenburg position. So basically getting the legs up in a passive leg raise is what they call that. We're going to do that for 5 minutes. And if we see an increase, a 2-point increase in end-tidal CO2 and a 10-point increase in systolic blood pressure, that is a positive indication this patient would be fluid responsive.
All you need to do is hit the link in the bio, and we're going to send all of our daily videos straight to your email so you can get your daily dose of medicine. Hit the link in our bio and sign up right now.